There's a word almost nobody knows, and yet right now, as you're reading this, there's a real chance it's happening inside your own body. It's called diastasis. And before you assume this is just a mom thing, let me stop you right there. Men get it. Kids get it. Women who've never carried a pregnancy get it. And if a doctor has already told you that the only way out is surgery, general anesthesia, the whole works, I need 30 seconds of your attention, because that advice could turn into the single most expensive mistake you ever make with your own body. I'm Dr. James Waterling, and after 15 years of sitting across from real patients, I've watched too many people get pushed toward operations they never actually needed. Nobody's going to walk you through this at your next 5-minute appointment because the system doesn't profit when you fix yourself at home for free. So I'm going to lay it out here instead. Let's start with what diastasis actually is. The full name is Diastasis Recti, and all it means is that your abdominal muscles have pulled apart. Picture the front of your stomach. There are 2 long straps of muscle running vertically, one on the left side, one on the right, the ones people call the six-pack. Running down the center, stitching those 2 straps together, is a band of tough connective tissue called the linea alba, Latin for white line. That white line isn't muscle. It's the same category of tissue as your ligaments and tendons, and its entire job is to hold those 2 muscle straps snug against each other. Now here's the part most people never hear. That white line is wrapped in broad sheets of connective tissue called fascia, and in the middle, those sheets fuse into one strong seam. That seam is what keeps your belly wall firm and closed. But when that seam is weak, when the tissue is loose instead of tight and springy, it starts to give under pressure. The 2 muscle straps drift apart, and a gap opens right down the middle of your stomach. So what actually causes that seam to give way? The single biggest driver is pregnancy. Over 9 months, the growing womb slowly stretches every tissue in the belly, including that white line. Here's the key detail though. If a woman's connective tissue was strong and elastic to begin with, once the baby arrives and the womb shrinks back down, the muscles pull back in and the white line tightens up again on its own. But if that tissue was already slack going in, it simply doesn't spring back. It stays stretched. The gap itself can range wildly. Some women measure 2 centimeters, less than an inch. Others measure 3, 4, 5, even 8 centimeters, more than 3 inches wide. And I want to be upfront about something important. A small separation above the belly button, around 1.5 to 2 centimeters after childbirth, is completely normal. It's not a problem. It's often just biological proof that a woman has given birth. That's not something you need to fix. But here's where it gets serious, and where most people go wrong in one of 2 very different directions. One group reaches for the wrong exercises, thinking they're helping. The other group rushes straight into surgery, thinking that's the only real solution. Both choices can make things worse, and in the next part, I'm going to break down exactly why the classic sit-up, the exercise everyone assumes builds a flat stomach, is actually one of the worst things you can do if you have this condition. So let's pick up exactly where we left off, the 2 big mistakes people make with diastasis. The first one is trying to fix it with the wrong exercises. And this is critical, so listen closely. If you have diastasis, you must never do movements that lift your torso or your legs off the ground while lying flat on your back. Here's the mechanism. The moment you lie down and lift your upper body, or lift your legs, your belly bulges outward immediately and the pressure inside your abdomen spikes. Then, as you keep pulling your rib cage toward your hips, you push your internal organs downward even further, and that internal pressure climbs even higher. Every single time this happens, the white line gets stretched a little more and the gap gets a little wider. So the classic sit-up, the classic crunch, the exact move most people believe carves out a flat stomach, is the exact move that widens diastasis. If you have this condition, those exercises need to come off your routine completely. No exceptions. The second mistake is rushing straight into surgery. When a woman has a visible separation, 4, 5, even 8 centimeters, she's often offered an operation to stitch the muscles back together. Usually it's a keyhole procedure. Small incisions, the surgeon goes in, sews the muscles closed, and sometimes reinforces the area with mesh. From the outside, it looks like a clean fix. It holds. But surgeons themselves have a saying, and they mean every word of it. The best operation is the one you never had. And here's my honest position, built from what I've actually seen with my own patients. In the overwhelming majority of cases, diastasis can close without surgery at all, and it doesn't require some heroic transformation. Think about the trade-off. On one side, a handful of targeted exercises, some connective tissue strengthening, maybe a couple of supplements to close a nutrient gap. On the other side, general anesthesia, which is a genuine shock to the body and can affect memory and mood afterward, plus permanent scar tissue that pulls and tightens the surrounding area for years. Given that comparison, doesn't it make sense to try every reasonable non-surgical option first? And here's the part that should really motivate you. Everything you do to close this gap also makes you healthier overall, not just in your stomach. Because when we talk about closing diastasis, what we're really talking about is strengthening your connective tissue system-wide. And I want you to follow this chain of logic, because you can trace it without a single lab test. If you have diastasis, you likely have weak connective tissue. If you have weak connective tissue, you likely have a broader pattern called connective tissue dysplasia, meaning your body builds this tissue too loosely across the board. That pattern usually travels together with low vitamin D and shortages of the key minerals your body needs to build strong tissue in the first place. The ideal path is real. Blood work with a doctor who actually reads the results and starts closing those nutritional gaps. As your tissue strengthens everywhere, every single exercise you do closes the diastasis faster. And here's something you need to fully understand before we go further. Weak connective tissue never stays confined to one spot. It shows up everywhere in the body. In the next part, I'll show you exactly where else it hides and why your belly gap might be the first warning sign of something much bigger. Here's the piece almost nobody connects. Weak connective tissue doesn't just sit quietly in your stomach. It shows up everywhere, all at once, because it's a system-wide issue, not a local one. That's why weak connective tissue travels with a whole crowd of other problems you might already be dealing with without realizing they're related. Varicose veins, those swollen, ropey veins in the legs. Hemorrhoids. Organs that gradually sag downward inside the body. Stretch marks on the belly, thighs, or back, regardless of pregnancy. A heart valve condition called mitral valve prolapse, where one of the heart's valves is too floppy to close tightly. Poor nearsightedness. Trouble with teeth, nails, and hair. Joints that crack, ache, or bend further than they should. All of it traces back to the same root cause. Loose, weak connective tissue. And if you've had some chronic issue nagging at you for over a year with no clear explanation, that's often a loud signal that your metabolism and your connective tissue need real attention. So when diastasis shows up, it's actually telling you something much bigger than your stomach muscles separated. It's flagging a system-wide issue while there's still time to correct it. And in a strange way, you can genuinely thank that gap in your belly. It pointed you toward the real problem before it became something harder to reverse. Fixing the underlying tissue doesn't just close the gap, it strengthens your entire body, which translates into a longer, sharper, healthier life overall. Now let's talk prevention, because we've established diastasis shows up most often in women after childbirth. But we've also agreed it's not really the pregnancy itself causing the damage. It's the weak connective tissue underneath that was already there. Still, to stop diastasis from forming or worsening, here's what I'd tell every woman after giving birth. Wear a support band for the first 2 months, then transition into supportive firming garments from month 2 through month 6. Here's why this matters. The moment the womb empties, the internal space in the belly suddenly shrinks. But muscles that spent 9 full months stretching cannot snap back into place instantly. They stay stretched out, and in that window, they genuinely need outside help. A support garment takes some of the load off those muscles and gives them the time they need to slowly, gently draw back together on their own. Before I hand you the actual exercise, I want to talk about age, because it changes everything here more than most people realize. After 40, your body produces new collagen more slowly, and collagen is the protein that gives connective tissue its strength and elasticity. That means the exact same gap will close faster in a younger body and will require more patience in an older one. So do me a favor, tell me your age. I genuinely want to know which age group makes up most of the people reading this, because it changes how quickly you should expect results, and it shapes what I cover next. Alright, here's the exercise I promised you, the one I consider the single best tool for closing diastasis, and I only teach things I've personally tested. The logic behind it is almost embarrassingly simple. If you want a flat, pulled-in stomach, you pull your stomach in. That's the entire concept. Here's exactly how to do it. Pull your belly in as far as it will go. Pull your belly button back toward your spine and hold it there. Don't let it release. While keeping that stomach pulled in tight, You start pulling even harder and short, sharp pulses, trying to draw the belly button in deeper and deeper with each pulse. You can breathe out in small, short breaths between pulses, but in those pauses, you never let the belly fully relax. How long do you keep going? Until your body genuinely says it can't do any more, until the muscles start to fail and cramp. Then, very slowly, release the tension. Even doing it once, at this intensity, you'll feel your stomach tighten and pull in almost immediately. Here's the mechanism behind why it works on the actual gap. Those two muscle straps that drifted apart, with a window of separation between them, get firmer and tighter every time you train them this way. They start pulling back toward the midline, and bit by bit, they close that window. I've personally seen women scheduled for surgery with a gap of 7 or 8 centimeters, more than 3 inches. Do this exercise consistently for a single month, and find the separation had shrunk so dramatically that surgery came completely off the table. Do this at least once a day. Honestly, I'd tell everyone to do it, diastasis or not, because we all need a strong lower belly as a foundation for the entire body. And here's what makes it genuinely valuable. You don't need a special position, a mat, or any equipment at all. You can do it lying down, sitting, standing, or even while walking. That's what makes this so different from a typical workout move. It asks for nothing. When you're out on a walk and you remember it, you just start pulling that belly in, and you're doing your body a real favor in that moment. If your diastasis is large and noticeable, do it 3 or 4 times a day, with 3 or 4 sets each time, pushing until the muscles start to cramp. That's the intensity that produces fast results. And I'll tell you plainly, based on what I've seen repeatedly, it doesn't matter how many times you've given birth, 1 child or 5, you can absolutely get your stomach back into excellent shape. It comes down to doing the right exercise with the right effort, consistently. This is the one that gets you there. So here's my final takeaway for you, and it's the part I want you to actually act on, not just read. If you currently have a gap, stop the crunches and sit-ups today. They are actively making it worse. Start the draw-in exercise once a day, more often if the gap is large. Get your vitamin D and mineral levels checked with real blood work. And most importantly, treat this gap as a message about your whole body's tissue health, not just a cosmetic flaw to hide. Do all of that consistently, and in the overwhelming majority of cases, you will never need an operation at all. Let's bring this all together, because everything I've walked you through connects into one simple truth. Your body was already trying to tell you something, and diastasis was just the loudest, most visible signal of it. A gap in your stomach isn't a flaw to be embarrassed about or a problem that only surgery can solve. It's a message about the strength of your connective tissue, system-wide, and once you understand that, you hold the actual power to reverse it yourself, at home, without a scalpel. Think back through everything we covered. The white line running down your stomach isn't muscle, it's connective tissue, and its strength depends on the same collagen and mineral foundation that affects your veins, your joints, your heart valves, even your skin and hair. That means the gap you see in the mirror is connected to a much bigger picture of your overall health. Ignore it, and you're only patching the surface. Address it properly, strengthen the tissue, correct the nutrient gaps, do the right exercises, and you're improving your entire body, not just your midsection. We also covered the 2 biggest traps people fall into: doing crunches and sit-ups, which feel productive, but actually spike abdominal pressure and widen the very gap you're trying to close. And rushing into surgery, accepting general anesthesia, permanent scar tissue, and real recovery risk, when in the vast majority of cases, the body can heal itself with consistent, targeted effort instead. Surgeons themselves will tell you, the best operation is always the one you avoided needing in the first place. And then there's the actual solution, the draw-in exercise. No equipment, no mat, no privacy required. Something you can do lying down, sitting at your desk, standing in line, or walking down the street. Pull the belly in, hold it, pulse it harder and harder until the muscles genuinely fatigue, then release slowly. Do it daily, more often if your gap is significant, and give your body the consistency it needs to rebuild that connective seam from the inside out. Pair that with real blood work, correcting low vitamin D and mineral shortages, and wearing supportive garments in the months after childbirth if that applies to you, and you're giving your body every possible advantage to close this gap naturally. I've watched women scheduled for surgery with gaps of 7 or 8 centimeters completely change their outlook after just a month of consistent effort. Age matters here. Results move faster in younger bodies and require more patience after 40, but the outcome is achievable at nearly any stage of life. Here's the truth I want you to sit with. Nobody in a 5-minute appointment is going to walk you through any of this, because there's no financial incentive in a patient who fixes herself at home for free. That's exactly the gap this channel exists to fill. No pun intended. I'm not here to sell you a procedure. I'm here to give you the information that actually helps you avoid one when you don't need it. So here's what I want from you right now. Drop your age in the comments so I know exactly who I'm creating content for. Tell me how your stomach feels the first time you try the draw-in exercise. And if this actually helped, you understand your own body better, hit subscribe, leave a like, and help this channel reach 300,000 subscribers. We're building something real here, one honest video at a time, and I want you along for it.